let's talk, though, about the NHS, various different stories, including a cyber attack on major London hospitals yesterday, also a new manifesto for our healthcare system from the British Medical Association, currently planning a strike just ahead of election day, but also news about yet another thing from the miracle cure that apparently is Ozempic. Apparently it can make us all live forever, or I don't know, whatever the latest claim is. Let's talk about all of this now with Dr Laurence Buckman. He's a GP and former chair of the British Medical Association's GPs Committee. Good morning to you.
Good morning.
Thank you so much for joining us. Let's talk just briefly, first of all, about this cyber attack yesterday on major London hospitals. It's not the first time the NHS has faced a cyber attack, but do we know who's behind it, what the motive is, and what was the impact?
The impact of these attacks is enormous. The who's behind it, I've no idea, because I can't think what pleasure there is in it, and I'm assuming this is about getting a ransom from the NHS. Certainly, whenever I've experienced some problem with the central computer system, you can't find out who's coming to see you. You don't know what they're coming for. You can't get access to their records. You can't give them a prescription. You can't look at their pathology results. And the pathology bit is what hit the hospitals the most. And that basically means you can't work. None of us now run parallel paper systems. So it's near impossible to work. Of course, you can see people. They walk through the door. They think they've got an appointment at time X, and you can write down whatever's happened. But this is a real disaster.
There's a massive benefit to things being streamlined on computers and all being technological. It speeds a lot of things up. We all know now when you go on the NHS app and you get yourself your prescription delivered straight to the pharmacy, all lovely jubbly, all done, instead of going there and picking it up. But when the system don't talk to each other. But I mean, do we know if the NHS, are they particularly a target of cyber attacks? Because we've heard of high profile attacks before. Do they pay ransoms in these circumstances, or was it a foreign government, which has happened before?
I think the general policy of almost all public institutions is to not pay ransom. And indeed, I'd be outraged as a taxpayer if they did pay. So I think what you just have to do is get yourself up and running. Usually these things start working after a while. Any break we've had at the surgery has been corrected within 6 hours. But for goodness sake, 6 hours is a bloody long time when you're trying to see patients, because you can't. And it's a nuisance.
Indeed. Well, let's talk about the BMA and their manifesto they put out for the next government, whoever's in charge. It does look like to be a Labour government, according to the current polls. And their argument basically, if there are no doctors, there will be no healthcare, which is a fair point. You used to be chair of the BMA GPs committee. We've still got GPs and they're not in battle with the government right now. The consultants have done their deal. The junior doctors still haven't. They've got planning a 5-day strike in the days just up to the election day. They're right. We need doctors, but what do we need to do to get more doctors working in the NHS? Because we don't need any more paper pushers, that's for sure.
No, we don't need paper pushers. And I'd love to tell you money would fix it, but I'm afraid I don't think that's true. I'd be just as tired for double the pay. So there are just not enough people.
Why are doctors so tired now? My mum did a very full day's week, week's work, when she was a GP. She worked a 5-day week. She was on call at weekends routinely for, every fourth weekend or whatever it was, the GP rotation. GPs don't even do that anymore. Why are GPs so tired all of a sudden?
I think because the level of demand has risen beyond where it was when your mother and I were GPs, were working as a GP. And so the number of people who want to be seen so rapidly exceeds the supply.
And isn't it also that appointments have to be made? It's people working part-time, and so there's no continuity of care. Oh, Mrs. Bingham, right, lovely to see you. Yes, now, so how did that work? Right, well, they can sort things out. But also, often doctors now are saying, well, no, there's only one thing. If you've got an appointment for your backache, you can't mention the urinary tract infection as well. And so you make another appointment. Isn't there actually just a computer says no aspect to how GPs are working now? Because surely I can put my prescription through online, or I could just write a note and say, could you possibly, arrange for a consultation for this? The fact that most of my dealings with my doctor don't involve me ever going into the surgery or wasting their time face to face. Surely that should have speeded things up and made it easier for doctors. I just find it a bit bizarre that they're all knackered all the time and can't cope and have to work part-time because of the hours. I just don't buy it.
Right. Well, I'm afraid I do. I think the pressure on doctors to make decisions, both hospital doctors and GPs, the pressure on them to make more and more decisions during the time they're at work exceeds their ability to handle it. Now, whether we say, well, they're all snowflakes, I'm a dinosaur and it wasn't like that in my day. You can't say that. The fact is that the way the health service works now is at 100% capacity pretty much all the time. There are exceptions to that rule, but by and large, they're flat out. And what they need more than anything else, for example, in hospital, is not to cover holiday shifts. Because at the moment, what happens as a hospital doctor, if somebody takes time off, they're plagued with guilt because they realise all their colleagues and they have to cover for them. They don't get locums. Now, I'm not suggesting that I want a sort of a posse of locums running around the NHS. I'd rather have properly employed people. But if you gradually stretch the elastic beyond its limit, you find you can't deliver.
Okay, well, that's fair enough. Just finally, I just want to talk to you about Ozempic. And we were told not only does it tackle weight loss, with Ozempic and Wegovy, these weight loss jabs, it can also tackle, we're told now, type 2 diabetes. Well, that would be because you've lost weight. I mean, duh. But also heart disease and stroke. Now, they're saying it could actually cut people's chance of getting cancer. How?
Right. When you're obese, your risk of cancer is higher than if you're thin.
Yeah.
It doesn't mean you can't get cancer if you're thin, and it doesn't mean you're going to if you're fat. But there's a definite connection between overweightness and cancer.
Yeah.
We know that Ozempic and related drugs actually generally lowers your weight. So the question is it working because it's lowering your weight? Or is it working because of some independent factor in the drug that's nothing to do with your weight whatsoever?
That's what the research is going to have to show. That's indeed. As general, losing weight is good for you. And good for the NHS and the pressure on doctors, it would appear. Dr. Laurence Buckman, always so good to talk to you.